In the name of God, I beginning another part of the lesson. We would speaking about the inguinal canal. You can see here is the symphysis pubis. Here is the superficial inguinal ring. It is the terminal part of inguinal canal. Here is deep inguinal ring. The inguinal canal beginning is from deep inguinal ring. The deep inguinal ring is in the fascia transversalis, and the length of inguinal canal is only 4 centimeters. The inguinal canal beginning from the deep inguinal ring and ended in superficial inguinal ring. I told you the inguinal canal has 4 walls. Anterior wall is here from aponneurus or external oblique. Inferior wall or floor is from inguinal ligament. Here is. But the posterior walls is from fascia transversalis and the parietal peritoneum. The posterior wall is very weak. When this muscle is very weak, the small intestines pressure the fascia transversalis and parietal peritoneum to the inguinal canal. This is named direct inguinal hernia. But in the indirect inguinal hernia, we have in the fetus a defect. I speak about this after the indirect. Now you can see here is inguinal canal. Here is the roof of the inguinal canal. They are arcuate fibers from the internal oblique and transverse abdominis here. This is roof of inguinal canal. You can see another shape here. This is superficial inguinal ring. I told you it has 2 crus. This is medial crus or superior crus. This is lateral crus or inferior crus. Between these 2 crus we have inguinal canal. Here you can see better. In the inguinal canal we have a spermatic cord. This is a spermatic cord. And second is ilioinguinal nerve. But in the female, in the inguinal canal, we have round ligament of uterus and ilioinguinal nerve. Third is the genital branch of genitofemoral nerve. Thus, in the inguinal canal contents are one is a spermatic cord in the man and round ligament of uterus in the female. But second and third is in the male and female. Second is ilioinguinal nerve. Third is genital branch of genitofemoral nerve. This is contents of the inguinal canal. You can see here inguinal ring. You can see here it is the layers of the anterior abdominal wall. You can see here better. You can see here this is peritoneum, parietal peritoneum. This is fascia transversalis. Between 2 this layer is extraperitoneal connective tissue. This is yellow color. And when we going to extern this internal oblique, it is transverse abdominis muscle, it is internal oblique, and it is external oblique, and it is inguinal ligament. From here, this deep inguinal ring, to here, superficial inguinal ring, this is named inguinal canal. Here is medial crus. Here is lateral crus. Here is pubic crest. Here is superficial inguinal ring. That it is open to scrotum. You can go into another. You can see here. It is inguinal canal. Going to another here. We are going to another picture. We speak about the inguinal hernia. I told you direct inguinal hernia are in the woman and most are bilateral. Thus, direct inguinal hernia in women are rare. This means many less. And the direct inguinal hernia are bilateral. It is a disease of old men, because in the old men we have weakness in the muscles. Here is named with weak abdominal muscles. The direct inguinal hernia can be summarized as follows. It is common in old men with weak abdominal muscles and is rare in women. Here is seat for hernia. This is direct inguinal herniation. The hernial sac bulges forward through the posterior wall of the inguinal canal medial to the inferior epigastric artery. You know, it is hernial sac. Here is pubic tubercle. It is pubic tubercle. What's the difference between femoral hernia and inguinal hernia? What's the difference between this? The inguinal hernia is the hernial sac is medial to pubic tubercle. Here is. But in the femoral hernia, the sac of hernia is lateral to the pubic tubercle, like this. Here the sac is medial to the pubic tubercle. It is inguinal hernia. But in the femoral hernia, the hernial sac is lateral to the pubic tubercle. The inguinal hernia is common in men, individual, the senile men, but the femoral hernia is common in women, because the femoral ring in the women are larger than the men, but the inguinal canal is larger in the man than to the woman. It is the neck of the hernial sac here. Here is explained what I told you about this hernia. An inguinal hernia can be distinguished from a femoral hernia by the fact that the sac, as it emerges through the superficial inguinal ring, lies above and medial to the pubic tubercle, like this. Whereas that of femoral hernia lies below and lateral to the tubercle. The file is going to over because it is 10 minutes. If the file is after 10 minutes, maybe not be uploaded for you. I end, and in another file we continue. Thank you for attention.